So in organizations, we sometimes come across teams that are dysfunctional, and often what people do is attribute those problems to personality differences. But almost always it's not down to personality differences. Yes, there are exceptions sometimes, but it's usually down to a number of factors. One is teams not having clear objectives, so people are not aligned around what it is they need to be doing together. The clearer the objectives of the team, 5 or 6 objectives, the more likely they are to work effectively together. Second, it's really important to ensure that teams have clear roles so that there's not ambiguity or confusion about who's supposed to be doing what, because that can be a source of dysfunction or conflict. Third, it's really important that teams create a sense of psychological safety, that people value each other, respect each other, create a positive climate so that then people feel safe to talk about errors or concerns or problems or issues. Fourth, it's really important to ensure that when there's conflict in teams, that conflict is dealt with early and not allowed to fester. Interpersonal conflicts, chronic interpersonal conflicts, are simply a disaster for team working. So it's really important that they're dealt with really early. We must never let our interpersonal differences get in the way of our working effectively in teams to deliver the high quality, compassionate care that we want to deliver for people in our communities. Fifth is it's really important that teams meet regularly. In my experience, some of the most dysfunctional teams I've encountered are teams that have just failed to meet on a regular basis, so they've kind of lost their sense of collegiality and cohesion and coordination. So teams should meet regularly, and also meet regularly to review what it is they're trying to achieve and how they're going about their work. And finally, it's really important that teams don't just focus on their effectiveness as a team, but they also focus on working effectively with other teams within their organization or outside their organization to deliver high quality, compassionate, continually improving care to people in their communities. Because one of the causes of team dysfunctionality is a failure to work effectively with other teams in organizations. So if we take those steps and ensure those characteristics are present in our teams, we can create teams that are truly dream teams and effective in achieving what it is they're there to deliver.